Hi, my name is Helen Newton, and my behaviorist biography is on Gina Green. Dr. Gina Green, she is an ABA superwoman. Gina Green is a living legend, still very much alive and actively involved in research, policy, and practice of applied behavior analysis. Her research has shaped both ABA practice and policy and influenced how ABA is implemented and practiced today. She is currently the CEO of the Association of Professional Behavior Analysts, a nonprofit organization focused on advocacy, legislation, and competency within the field of ABA, which she also helped found in 2007. She previously served as the president of the Association for Behavior Analysis International. Her research and advocacy has influenced policy that regulate, license, and certify behavior analysts, as well as the training programs, the graduate and doctoral level programs, and continuing education required in the ABA profession. Dr. Green is an author, an advocate, a collaborator, and an innovator. Gina Green's work has been published in peer-reviewed journals around the world. She has authored books instrumental in ABA interventions and practice. Gina Green's focus on policy and competency in practice directly impacts the clinical practice of all behavior analytic professionals. One thing that she was a part of was she was a representative for the ABA Coding Coalition, which was essentially a collaboration of ABA organizations and the American Medical Association that defined and established billing codes that carry out and regulate ABA services. So those billing codes that we fill out when we do our treatment plan notes, she was a part of that. So this is important because the billing codes categorize treatment services needed for each individual receiving ABA services by type and cost, which gives insurance companies, Medicaid, and other funding sources the necessary information to pay for these services. This is important for all of us because billing for services is what pays ABA practitioners, which allow us to work and deliver services to the clients who need our help. So two of her main contributions are ABA policy and ABA practice. So this is going to focus on the policy portion of her contributions. One of her authored publications highlights the importance of BACB guidelines as a framework to increase competency for ABA practitioners. Green argues that the guidelines are not enough to engage scientific evidence-based practices and urges practitioners to evaluate interventions and treatment through additional scientific methods and measures to ensure that the science of ABA is implemented throughout service delivery. Johnston et al., another research team she was a part of, examines positive behavioral support, or PBS. This is a widely popular intervention for problem behavior, and they use the antecedent behavior consequence three-term contingency to examine the function of behavior. The PBS model is used in schools and treatment settings all over the country and gained popularity when it was promoted through the federal special education policy, the IDEA Act. The authors argue that ABA could gain popularity and accessibility on a wider scale by informing policymakers of evidence-based benefits of treatment using the data-driven effective interventions provided by highly trained ABA practitioners. So PBS became popular because it was part of the IDEA Act. So it was a federal policy that essentially highlighted that PBS was an effective intervention, and thus why it's used so widely. So what this article talks about is how ABA can learn from the PBS model by influencing policy and policymakers to choose ABA as an effective intervention because it has all these great benefits based on data, and we can see in our data that the ABA model is effective. Okay, the second contribution that she has to ABA is the focus on practice. So most of her practice and research has been on interventions for children with autism. So her research supports that ABA interventions are an effective treatment for autism. Vets in Green, which is another article I reviewed, urges practitioners to use data to guide intervention, as well as assessment and observation of the child's functioning. They also suggest the importance of developing interventions that tailor to the needs of each child, including their short-term and long-term goals, to improve their overall functioning and well-being. So that's something that we do with our clients all the time is we individualize the interventions and focus on their strengths, their challenges, and as well as their short and long-term goals to guide what interventions we choose and carry out. And a research finding she was a part of was MacDonald et al. 2007 found that stereotypy, or the repetitive behaviors, can increase significantly with age if a child is diagnosed with autism. So this supports the findings that ABA therapy for children 2 years or younger is an effective intervention to improve their outcomes. So we know that the earlier a child is introduced to an ABA intervention, the more likely their functioning and overall well-being will improve. So Howard et al. Found that intensive ABA interventions for 30 to 40 hours per week, implemented by trained ABA practitioners, the children with autism had greater improvements in their daily functioning when compared to less consistent generalized special education interventions and interventions that were not technically ABA but centered around autism. ABA worked better in improving the children's functioning and overall well-being when using the 30 to 40 hours intensive treatment model. So overall, her work found that individualized, intensive, evidence-based ABA interventions are effective in improving the functioning and daily lives of children with autism. Her work also emphasized the importance of competent, scientific-minded practitioners who use these evidence-based practices and data collection to implement the interventions that are shown to be effective and improve the lives of children with ASD. If I had an interview with Dr. Gina Green, I would start by asking her how she got her start in behavior analysis and what was her experience in the field when she first started her career. I also would want to know, as a woman and a trailblazer in the field of behavior analysis, what is one challenge that she overcame during her career? In one publication, the Training Practitioners to Evaluate Evidence About Interventions, which was published in the European Journal of Behavior Analysis, she discusses the pitfalls of pseudoscience and its unfortunate effects on the autism population. We've seen in recent years, especially on social media, there seems to be a growing popularity of the anti-vaccination movement that spreads misinformation about the effects of vaccines and the development of autism. Even though these have been disproven, they've been debunked, they've been discredited through scientific research. So I would ask her, what can practitioners do to defend the science of ABA and guide families and individuals away from the false information such as the anti-vaxxer campaigns? And my last question would be, what advice do you have for novel behavior analysts working with children with autism spectrum disorder? What are some ways that behavior analysts can advocate for the practice of ABA to reach more populations and communities worldwide? I hope you learned a lot about Gina Green. She is an amazing woman and definitely has inspired me, um, as I and many of us do work with children with autism, and essentially her research has guided how we conduct these interventions and what is the standard for these interventions. And as I stated in the beginning, she has been instrumental in developing the oversight and the guidelines that help guide our profession and keep us competent with the practices. Thank you so much.